experiment because my foster brother had experienced horrible tooth decay when he was only 5 years old. I was told he drank lots of sugary drinks like sodas and juices. Which conditions caused all this decay? And is there anything he can do to help prevent further decay?
Those are great questions. So, what likely caused the cavities in the first place sounds like his diet. Okay? By eating a lot of sugar, that is what contributed to the cavities.
Okay.
Well, the cavity process is more complex than what I'm about to tell you, but it's easier to understand it this way. In our mouth, we have a ton of bacteria, thousands and thousands of bacteria. Those are naturally occurring. And in a sterile environment, they really don't cause a problem at all. But when they combine with the carbohydrates from sugary foods, they produce an acid. And the acid then sits on our teeth if it's not brushed off or removed in another way. And over time, then that acid starts to wear away the outer layer called the enamel of the tooth. And as it progresses its way inward, it starts forming a cavity, which is basically a hole in the tooth. So, the fact that your cousin ate all these, sugar foods, then the bacteria in his mouth started to interact with that and cause this acid. So the ways that you can prevent it are very simple, actually. Is to minimize his exposure to foods that have sugar or anything with high carbohydrates. And two, to obviously be brushing and removing it effectively so that the plaque in our mouth doesn't have an opportunity to react with it and cause the acid.
Okay, ask the next question. So, in your years of experience, what is the most common culprit for tooth decay that you've ever seen?
Pretty much that.
Yeah.
The fact that they're not, the poor oral hygiene, meaning they're not cleaning their teeth, and a diet that is very high in sugar.
Mm-hmm. In my experiment, I performed 3 trials of soaking hollowed out eggshells for 5 days in Coca-Cola, orange juice, and water. I measured the pH values before and after the experiment. There was no change in the pH of the water. It stayed at a pH of 7. For orange juice, it changed from a pH of a 4 to a pH of a 6. And for the Coca-Cola, it changed from a pH of a 3 to a pH of a 7. Could you help me explain why this occurred?
I can't explain that.
Yes.
I'm afraid I cannot explain that. They're both very acidic, and why they became more basic over that time period, I'm afraid I do not have an answer for you there. That might be good for another research experiment.
Yeah. The eggshell soaked in Coca-Cola showed the most staining. Does staining mean there's also decay?
No. You can have a lot of stain, and the teeth can be rock solid hard. Staining does not necessarily indicate a cavity. Sometimes staining can be a cavity, but not always.
The orange juice soaked eggshell seemed to have had a breakdown in the outer layer of the shell, but had less staining. Is this what you would expect to see?
Well, the less staining I would definitely expect to see. The orange juice, that does not surprise me. As far as breaking down the shell, there may be something in orange juice different from the soda that interacts with the component of a shell. I don't know exactly what an eggshell is comprised of. But I would think that even the soda had some breakdown, but maybe it's just more apparent in the orange juice. I wouldn't necessarily read too much into that. But the staining, sure. Orange juice definitely just does not stain as much as Coke or coffee or blueberries, things like that. So that does not surprise me.
What role does genetics play in a person's having teeth which will or will not decay?
That is a difficult question to answer. It has been debated for years and years and years. What scientists have found is that early on, during the development of your primary or your baby teeth, and perhaps a little bit in the permanent teeth, is that genetics has more of a role than when you get older. They have located some genes that may be associated with decay, but can they single out certain ones in certain people that this would be contributing? They have not been able to replicate anything like that. So their thoughts are, is that, as I early on, your genes may contribute to the development of cavity, and it's really because the plaque, which is a bacteria that interacts with the acid and things in the carbohydrates, that may be, we call it, may be inherited, and as a result, maybe even when your stepbrother's young age, there's possibly a genetic component in that. But what they have found is that as we've gotten older, by the time you're probably 10 or 12, the environment overtakes the power of the genetics. So it's more environmental factors that are contributing to the development of decay than genetics. And as I said, it's more complex than what how simple I might have tried to make it, because it has to do with the components of your saliva as well. You know, what really is in that plaque microbiome. Just, you know, things that interact in your mouth. So that genetic component, there's still a question in that, and that is something that I can assure you that people in labs as you speak trying to see, you know, how big a role it really does play, and is that something that we can affect. So I guess early on, yes, genetics may play a role, but by the time you're into puberty and for the rest of your life, the environment is much more powerful than any genetic component could be.
It's very interesting.
Yes.
Well, thank you so much for your book.
So what I did find one thing for you maybe of value is you can take this, that's yours if you'd like, and it just kind of goes over. The big thing is that you know, what we're seeing more in our population today than we did when your mother was growing up, or when I was much older than her when I was growing up, is because is the role of it, how acid foods are. When I was growing up and your mother, we drank a lot more milk and water from the tap. Nowadays people are drinking water out of bottles which do not have fluoride, and we're drinking a lot more soda and sports drinks like Gatorade, and those are all very acidic to begin with. And so we do tend to see more cavities nowadays from these reasons than we used to. And we also see a lot more wear. There's something, a term called acid erosion, which is not a cavity, but you start to see the whole thing. You see how it's whiter here and then not as white here? Okay. So this is the enamel, the outer layer of the tooth structure. This is much more white. And we call this, it's radio-opaque, because anything that's white on an x-ray is opaque. So this is the enamel. Now if you look here, you see a little dark spot right there? That's the beginnings of a cavity. Okay? Right here. So in this patient, I would not recommend that we fill the tooth yet, because in order for us to want to fill a cavity, we generally want that to be at least halfway through the enamel. At this right now, it's just a little tiny speck. So what did I tell this patient? I told him, you know, you have the beginnings of a cavity, something we call incipient decay. You need to go home and you need to make sure you floss every day, because it's right in between here is where you'll be flossing, to remove any plaque or food that was stuck in there. Obviously your brush. And the last thing I want you to do is to rinse with the fluoride rinse for 1 full minute every night. Swish it around your mouth really well and then you spit it out. And you can't rinse your mouth out for half an hour. You can't even drink for half an hour. So it gives time for the fluoride in that rinse to penetrate that, because that fluoride can go right to that spot and it can stop it right away. It can stop it from progressing, and it can actually remineralize it, and you can make that stronger. So a year from now, when I take that next x-ray, I'm going to zoom in for sure at that spot. Now what happened over the past year? Did that get bigger? Because now do I have to fill it? Did it stay the same, to which we'll continue to monitor it? Or did it actually shrink a little bit because it got remineralized?
So interesting, because I just also am not a dentist or anything, but I wouldn't have even noticed anything. It's so small.
Right. You're right. It is very small. Obviously, my eye is trained. But you're right. But that's the critical part of that is noticing things early on. Try to be, proactive. So the next time, as I said, if that gets to be more than halfway through that outer layer of the enamel, then at that point we need to do a filling. This here, as long as we're here, I'll just go over this with you a little bit. So this is as I said, this white portion on the x-ray is the enamel, the outer layer. Then this is the dentin, the inner layer. This is more yellow in color, and I'm sure you've seen it on your models. And then this is what, I know you see it on your model, but the pulp or the nerve tissue, this is what it looks like on an x-ray. And I'll show you, this individual just had a root canal. He had trauma to one of his front teeth. Didn't show up very well, this x-ray. But you can see this little white material goes all the way down the root. That's what a root canal looks like when it's all done. They removed all the bacteria and the bacterial byproducts. The nerve is in that, and all the blood vessels are in there too. So everything had been removed during your root canal process. And now you have a hollow tube, and you have to fill that. So that's what a filling looks like in the middle of the root canal. Not the same type of filling you would do in the front of your tooth, but it's a filling material, different type. Just don't let anybody see that person's name on that if you're taking pictures of it.